The ethical questions of implanted brain-computer interfaces. First of all, what is a brain-computer interface, or BCI? It is a device that reads brain signals, analyzes them, and outputs the results to a computer that can perform an action such as moving a cursor on a screen, moving a robotic limb, displaying a visual rendering of firing of neurons, or giving immediate feedback to the brain. It can also take input from a non-brain source and output or write directly to the brain. BCIs can be non-invasive, where the device is placed on the head outside the skull, or invasive, where the device requires surgery to insert electrodes into the brain. Non-invasive devices give more generalized data and are lower performing because the skull and tissue barrier muffles the brain signals. They can generally only capture clear signals when thousands of neurons are firing together. These signals are captured by electrodes touching the scalp that are then recorded and analyzed. These components that collect and process the brain signals comprise what is called an electroencephalogram, or EEG. Some non-invasive devices that are open loop, meaning read-only or write-only, so one-way communication, are the NextMind sensors, which can be clipped to a VR headset or cap and reads from the visual cortex, which is the area at the back of the head, to recognize objects or buttons on the screen that you are looking at. It has an SDK for developers to create their own mind control apps too. And then there is the kernel headset that fully covers the head. It is a relatively low-cost device intended to promote more neuroscience research. A closed loop, meaning read with automatic real-time feedback, so two-way communication. Device example is the EEG headbands that provide feedback for meditation, such as Muse's meditation headband that measures brainwaves and gives auditory feedback in real time. Invasive devices are more precise because they are closer to the brain and listen to a smaller set of brain signals. Some invasive devices that are open loop or read-only are the Neuralink chip that sits on the brain with flexible electrodes sewn into the brain. There are no FDA-approved clinical trials yet, however. Then there is the BrainGate device, which sits atop the head outside the skull with electrodes inserted into the brain, and Synchron's Stentrode, which is minimally invasive as it doesn't require brain surgery, but is an electrode net tube threaded through a blood vessel in the brain that is close to the motor cortex. This has been FDA approved for clinical trials. Patients with invasive read-only devices have demonstrated ability to move a cursor on a screen and thus use a computer. An invasive write-only device example is the cochlear implant that has a microphone, speech processor, and transmitter outside the head, and a receiver and stimulator implanted under the skin, connected to electrodes threaded through the cochlea, which stimulate the auditory nerve, which stimulate the brain. Another write-only BCI is the deep brain stimulation device that counteracts Parkinson's disease tremors. This device acts similar to a pacemaker in that it delivers automatic stimulating pulses to the brain. An invasive closed loop, meaning two-way communication, so read from the brain with automatic feedback in real time, device example is the NeuroPace's RNS, or Responsive Neurostimulation System, for epilepsy. This device predicts possible seizures by detecting abnormal brain signals and sending stimulating impulses to normalize them, thus preventing the seizures from happening. It's so far the only FDA-cleared closed-loop invasive BCI. BCIs enable paralyzed people to use a computer, control prosthetic arms and legs, or type words to a screen by imagining themselves writing or speaking the words. They can treat diseases such as Parkinson's and ALS, or treat disorders like epilepsy. A hospital in Shanghai started clinical research on treating depression with BCIs. But not all BCIs are medical. Some are used for meditation, gaming, and VR. There are many BCIs in research labs and neurotech startup companies these days, but the most prominent is probably Elon Musk's Neuralink. The most attractive part of Neuralink is probably that it is fully hidden. No device is protruding from the head or chest like the others, but it is still invasive. It requires cutting through the skull and basically a robot sewing a chip into the brain. However, implanting in the brain will allow more precise brain signal readings. The device is also smaller than other BCIs and has high bandwidth. It also promises to be rechargeable, wireless, and affordable. Though Neuralink has yet to get FDA approval for clinical trials, this is only the beginning. The potential of BCIs is huge. I can see BCIs getting popular. It will most likely start with non-invasive devices as they get cheaper and video or VR games are designed around it. There are already a number of commercial use non-invasive BCI available. Some of Neuralink and other neurotech startups' midterm and long-term goals are treating mental health disorders with personalized neurostimulation, immersive VR, enhanced cognition, enhanced physical capabilities, telekinesis, telepathy, and memory stored in a repository. For all the progress BCIs have made so far, they are still barely scratching the surface of the complexity of the brain. But neuroscience has been paving the way for decades, and tech is making what is possible available to the public. However, even with solely medical BCIs, ethical questions arise, and even more so with non-essential BCIs. Some considerations are a loss of sense of self and autonomy. One epilepsy patient with an epilepsy alert BCI felt the device removed the feeling of being in control and became depressed by it. When life is dictated by a machine, although for your good, it can diminish one's sense of agency and render one feeling like a robot. In treating depression, what if the person is then unable to feel negative emotions? Do you lose a part of who you are? If the device is better at regulating mood and health, will you give up decision-making because it is easier to let the BCI keep you happy and healthy? If emotions can be regulated, what does that say about free will and being human if we can reduce fear and pain and enhance love and euphoria, not unlike in Brave New World? And then there are the practical ethical questions of privacy, data safety, and user control. Some ways to tackle ethical concerns would be for neurotech companies to design BCI around ethics from the beginning, before it becomes an integral part of life, and ensure that all neural data is yours forever. At least the neurotech companies, NextMind and Kernel, have that policy that sharing your brain data is opt-in. The device should also be able to be turned off and on at will. Perhaps federal policies should enforce this as well. Some future moral conundrums presented by this tech are rich people becoming mentally and physically superior because they can afford the best enhancement, or a world like Westworld, but where we are like the robots that with a computer can adjust cognition to increase intelligence, charm, persuasiveness, like a video game character. When that day of mainstream transhumanism comes, who will we be for real? We may have the ability to switch off, but will we want to?